Assalamualaikum warahmatullahi wabarakatuh. My name is Diva Tiara Juniar. I'm from Binawan University. And then now I want presentation my task about nursing care plan or NCP postnatal. Okay. My name is Diva. My ID number is 012444003. Now I want to briefly present a nursing care plan for mother after 1 day delivery, which I have been working on for about 2 or 3 days in the hospital. Please listen and sorry if there are many shortcomings and mistakes. Let's start. Okay, I want introduce my patient first. My patient is initial F. My patient, Mr. F, gave birth to her first child, a boy. Mr. F gave birth by cesarean section because the fetus was already quite old in her stomach. Estimate birth around 39 weeks, but until yesterday, Mr. F still didn't feel a heartburn. Mr. F has gone through the induction process, but it failed. Mr. F has a medical diagnosis of thrombocytopenia. So that's a strong person. Mr. F can give birth normally. Okay, basically I have 3 diagnoses in my book, but for this presentation I just took 2 diagnoses. Diagnosis priority, the first I want presentation is acute pain. Yes, the problem is acute pain. Associated with the symptom is agents of physical harm. Cesarean section procedure. Okay, I want reading analyze data. I have 2 data, subjective and objective. For subjective, the first patient reports pain in the lower abdomen. The patient says the pain is feel hot. And 3, the patient complains of the pain arising on the movement and pressure of on the abdomen. And she says overall pain it feels like 6 from 1 to 10. And then I have objective data. There was a possessor involved of Mr. F. And then number 2, the patient which in pain when pain occurs. Next slide, I have objective and outcome criteria. After carrying out nursing action for 2 times 24 hours, it has hope that pain will be controlled with the outcome criteria. First, being able to control pain, not remember pain, being able to use deep breathing relaxation technique if pain, and the 4, the scale is reduction from 6 to 2, and last vital signs are within normal. And that's my intervention. Intervention is like I do for my patient is first do a comprehensive assessment and then measure vital sign. Of course, 3, observe non-verbal reaction, suggest relaxation technique in case of pain, evaluation pain, and the last is collaboration with doctors regarding administration of analgesics. So, what's the evaluation? The evaluations I got from my patient is the S. Is the patient said that she still has pain in the lower abdomen on a pain state on the pain scale of 4 from 0 to from 1 to 10. And O are objective. The patient wins in pain when pain occurs. A, the patient problem is partially resolved. And P, continue intervention. Okay, that's the day 1, and we have day 2 about Mr. F. What feeling? And S, the patient said the pain scale was 2 from 1 to 2, from 1 to 10. And objective, the patient does not winch in pain when pain arises but does deep breathing relaxation. And what about A? Acute pain problem resolved. And B? Stop intervention. Intervention. The diagnosis I have is number 2. Acute pain breastfeeding is not effective. Associated with ineffective milk supply. Yep, so the symptom is ineffective milk supply. And I have analyzed data, subjective and objective, of course. The subjective, the patient said the milk had not come out, and then she doesn't really like vegetables, actually. What about objective data I have? The milk doesn't seem to come out yet. So this is the objective and outcome criteria and intervention what I do for Mr. F. First, I want to talk about objective and outcome criteria. I just hope after carrying out nursing action for 2 times 24 hours, it is expected to achieve feeding with the criteria of 1. Outwardly cool result. 2. The patient wants to eat vegetables and the portion of food increase. 3. The patient is able to do the breast effect. And 4. She will definitely breastfeeding his baby. And that's objective and outcome criteria. The next is intervention. I'm using breastfeeding assistance. What about first? I do palpate the breast, and then I do oxytocin massage for Mr. F, and then 3 teach and accompany the patient. 4 do breast massage, and last encourage the patient to consume lots of vegetables. So what about evaluation? For day 1, subjective, the patient says her breasts feel tight. And then for objective, the milk hasn't come out yet. The patient breast feel full. And A, the problem is ineffective breastfeeding is partially resolved. And the B, continue intervention. And the next day, we have about good uh, and as subjective. The patient family said the patient start routinely vegetable she consumed. Oh, the patient looked good at doing breast massage. The fetal sign within normal limits. And A, breastfeeding problem are not effective resolved. And for P, stop intervention. Okay, it is what I want to presentation. If I have something wrong or doesn't do good presentation, I'm so sorry because it's my second presentation in English. I can't have English fluently. So thank you. Assalamualaikum warahmatullahi wabarakatuh.